Welcome to the intersection of technology, cybersecurity, and society. Welcome to ITSP Magazine. Thank you for joining us for this conversation.
Hello everyone, you are very welcome to a new Their Story here on ITSP Magazine. I'm joined by our good friends at HITRUST, and they bring along another good friend of the industry and community from EHNAC, and it's a critical topic, certainly important, but I would even say critical topic that we're going to be discussing today, and it's driven by the framework TEFCA, the TEFCA framework, and it's really about interoperability. So what's the purpose of TEFCA? What's its objective, and what are we planning to do with that? And so many questions in my mind, so I'm not going to even try to go any further with this. I'm going to take now the chance to welcome Michael Parisi back to the show. Michael, thanks for joining.
Absolutely. Thank you, Sean. Great to be here today.
And also Lee Barrett. Lee, thanks for joining as well.
Thanks, Sean. Thanks for having me.
And you've both been watching this topic quite a bit for many years, and we're going to get into what it is. But Michael, a brief word about what you do at HITRUST, and perhaps even kind of connect that to the topic of TEFCA and things you've been looking at over the last couple of years.
Yeah, sure. Thanks, Sean. So I'm the Vice President of Adoption here at HITRUST. So my role is really to help organizations from all shapes and sizes and industries to manage risk more efficiently and more effectively by leveraging a number of our programs and solutions and those that we bring to market with some of our partners like EHNAC, and Lee and I will talk about that a little bit later on in the discussion. But if you dive into healthcare more specifically, when we talk about helping organizations identify ways that they can better manage risk, we're really talking about the largest risk that exists from a societal perspective, right? Which is the potential loss of human life. So a lot of what we're going to talk about today, Lee and I, Sean, alongside you, is where does this concept of interoperability play into a number of societal issues and challenges that we're trying to solve for as it relates to care delivery. And I know when I first heard the term interoperability, it's like, what is that, right? Why is it important? And thanks to my good friend Lee in educating me over the last several years, I learned why it's so important. And that's probably a good place to start, I would say, the conversation.
Yeah, and we certainly will. Lee, a few words about your role. I think you're deeply connected in the healthcare space. Tell us a little bit about what you're up to.
So EHNAC, as you were talking about when you introduced me, Sean, a lot of people may not know the acronym. So EHNAC is the Electronic Healthcare Network Accreditation Commission. So I'm the executive director and CEO for EHNAC and have been in that role for 27 years that we've been in existence. So as Mike was talking about, we have focused, our accreditation model has been focused, as well as Mike's, as a framework around not only privacy and security. We partnered with HITRUST for that, along with a lot of the stakeholder specific requirements that people are looking for as well within healthcare. So we have about over 20 healthcare accreditation programs in healthcare that we've developed. And we've focused over the past probably 5 years on development and of a couple of programs in this interoperability space. As Mike was talking about, really, we started working on interoperability probably about 3.5 years ago when a first version of TEFCA first came out. So we'll talk more about all that and kind of the evolution and where we started and where we are today on TEFCA, because really the final version of TEFCA was actually released on January 18th of this year. So it's taken that long, over 3.5 years, to develop this program. It's gone through a lot of iterations. So we'll get into kind of the value proposition here to the industry and to hopefully all of your listeners here on why is interoperability important. As Mike was talking about, I've been involved with it for a long time, and it's gone through a fair amount of iterations as far as how it's evolved as a term as well. So looking forward to talking more about kind of the value proposition and why people need to be aware of it.
Yeah, so let's actually just start there. So in terms of interoperability, and maybe each of you can share a scenario or a story where something good comes from putting some standards in place and a process around how to share and leverage data to provide better care from an interoperability perspective. So what's possible now with TEFCA having passed in January? Or what's the goal, I should say? Maybe not possible yet, but what's the goal?
Mike, want me to start?
Yeah, why don't you start, Lee? Yeah.
All right. So I think, the best way to put this in perspective for the audience is really the example that I use is today. If any one of you are traveling, and let's just say Lee is traveling and he lives in Connecticut, but he's in California, and gets rolled into an emergency room in California. He's unconscious, and that attending physician is trying desperately to get a read on my electronic health record without understanding my entire health record. The amount of treatment that attending physician can provide to me is somewhat limited. They don't know if I've got allergic reactions to certain medications, et cetera. And so mortality goes up because there's a limited amount. They'll do everything they possibly can to make me comfortable, but they won't be able to provide the level of treatment that they could if they knew my entire EHR. So let's take that same scenario 2 years from now, as interoperability and TEFCA gets implemented. That same scenario, Lee gets rolled into an EHR in an ER unconscious. They're able to find my wallet. They get my driver's license out. They key my driver's license number into the EHR system. It immediately goes out and polls all of these what are called qualified health information networks across the country. It'll assemble my EHR in seconds for that attending physician. That attending physician now has my entire EHR in front of them to be able to now know my entire history and can start treatment. And guess what? Mortality goes down. That's the value proposition. And that's what it does for not only treatment from a patient perspective, but the other aspect is what TEFCA is all about. It is really as well to provide patients with greater capabilities to be able to manage their EHR, manage their care coordination, have greater access to all that information, and hopefully to get to the point, many of you are probably saying, well, geez, I have to go to multiple portals now to get access to my information. And I don't like doing that. I've got all my family members, I've got all these various portals. The hope is that we can get to a single portal or a single capability from a sign-on perspective with all of the security and privacy that needs to be there, but make it easier for patients to be able to not only access their information, but whether it's patients, I also bring up the example that if somebody is going through, say, a cancer treatment and they're going through chemo, in many cases, patients are so sick as they're going through that, they really can't coordinate their care. So they need a care coordinator. What this will provide is the ability for whether it's the patient or a care coordinator to have access to the information to coordinate an entire continuum of multiple doctors and others that they need to coordinate with for that patient's care. That's another major value proposition here that interoperability is going to provide for patients. So let me stop there, but hopefully that provides some spectrum. I don't know, Mike, if you've got other thoughts there.
Yeah, I mean, related to that is, not just decreasing those mortality rates overall, but also improving the speed of care delivery. Right. So I think as Lee was mentioning, there are mechanisms in place today to obtain relevant information around, somebody's medical history and what care has been delivered in the past, maybe even what they're allergic to from a medication standpoint. But albeit sometimes those are not often that reliable, right? Number one. And it's slow. I mean, anybody that's been through our care delivery model, know how slow it is to get referrals, to get access to medical records and information. And when it comes to delivering care in some of the instances and examples that Lee was talking about, we don't have time, right? Because if it takes that long and we can't speed up the delivery of information to make better informed decisions around care, unfortunately, it will result in more deaths, right? So what we're talking about is real, and it's really going to impact people's lives overall, and certainly the lives of their friends and family and loved ones, to ensure that the care delivery model is not only more accurate, but also quicker.
Yeah, and I think it's easy to go from one end to the other. We can look at the extreme of preventing deaths, and then the other extreme is everybody's perfectly healthy. We provide societal care, community care, precision care, 100%, no issues, right? But reality is we're in the middle somewhere. And in that middle is chaos and uncertainty and inefficiencies that could lead to death, could lead to poor health, could lead to frustration, certainly leads to waste and costs that we shouldn't have to deal with as a healthcare environment. And I can see, I'm really interested in this idea of the patient, because Mike, you said, how reliable is that information? How current is it? How relevant? How accurate is it? And I think as a patient, having a view into what's going on with your own personal health is key to all of this. So maybe with that, can you maybe touch on some of the stakeholders? Well, maybe first, sorry, let me take a step back. What's the infrastructure look like? Because there are health networks already, right? And there are some of those connect together where there are partnerships and relationships. Are we talking here that those connect them within state and cross state borders for a national system, or what is it we're talking about here? Can you paint a picture of what that looks like?
Yeah, Lee, you want to go first on that one?
Sure.
Yeah.
So today, you're right, Sean. A lot of these entities that are out there are not connected. For example, these health information networks that are out there, these HINs, we refer to them as HINs. Many entities have to belong to multiple HINs to be able to gain access, and many don't share many HINs don't share information between themselves as well. So you've got this disjointed, disconnected network of networks that's out there today.
And can you put, sorry, Lee, can you put labels on those? Is that a hospital versus a doctor practice versus a lab versus?
That's hospital. That could be hospital to hospital, doctor provider to hospital provider to, and then there's these health information networks that are actually data aggregators, Sean, for hospitals and payers, where a lot of data from a population health and other aspect, they're managing a lot of that data. And again, what's happening between all these various stakeholders is a disconnect. We haven't even gotten to the point, we've made a lot of progress, but we haven't gotten to the point that you can talk EHR, electronic health record system, to EHR from one hospital to the next. And again, we've come a long way as far as how some of that is happening through standards, some of the standards that are being used. And people are using these FHIR application program interfaces, which is developed as a standard by Health Level 7. that's starting to promulgate as far as interoperability out there, and that's really important as far as starting to gain access. But TEFCA, along with FIRE and the Office for the National Coordinator, ONC is really going to have responsibility for, I would say, architecting this new infrastructure for interoperability. So going back to your point, the issue is today we have all these disconnects between various organizations and cannot share data. The intent and the fact is, if an organization wants to share data with another entity, they have to negotiate separate agreements on how they're going to share that data. All of that takes time, money, cost to the infrastructure and to the system. What TEFCA is looking to do, therefore, is to eliminate individual contracts, have one common agreement that these entities will sign. They're going to have these qualified health information networks, which will basically take the place of individual HINs, health information networks that are out there. So there'll be one agreement. These QHINs sign one agreement between themselves and between all of the what they're calling is flow down entities. So whether it's a provider, a payer, a lab, or pharma, all of them will be able to work with these various QHINs. And again, the intent is to try to get to a single agreement. So now we're cutting out all the time and cost for individual agreements. That's one. Two, we get to the point where we break down the barriers where I can't connect to this HIN because they're not willing to connect to me. All of that now gets taken away, and now we've got these QHINs, however many of those we'll have, in which they'll be connecting with all these flow down participants, they call them participants, and sub-participants that will be sending information into them. So now we've gotten a single agreement, we've got connectivity between all of these QHINs and all the participants, and now we've created the connectivity that we need to get to the point where patients have access to the data, and there's a value proposition, whether it's a patient, to the providers as well, as far as care coordination, to the payers in relation to as well how they're sharing data amongst all these entities, and whether it's technical app developers or public health, as we're just coming out of a pandemic here, there'll be a lot greater ability to share and have access to data than we do today. So that's kind of part of the value proposition that this whole aspect around interoperability in TEFCA starts to work towards implementing and resolving the problems that we've had over these past number of years. And again, it's a matter of leveraging a lot of the standards that are already in place. But the other aspect that becomes important to all of this is an overarching aspect around privacy, security, and assuring stakeholder trust between all of the participants that are going to be part of this. So, Mike, I went into probably a little more depth here, but there's a lot of moving parts to it. What did I miss as far as what would you add?
Yeah, as usual, did a fantastic job, Lee. I think on the stakeholder side, Sean, this obviously only works, I think, as Lee has alluded to, if all of those cats are herded appropriately, right? Because if we don't have the ability to share that data across the ecosystem, then interoperability doesn't work. But it's important to note just how many different types of stakeholders, organizations, and people are part of that equation. Because if you step back for a second, I think it makes sense that, okay, there's going to be these networks that have existed for a while, data aggregators, as Lee mentioned. That's pretty obvious, right? That we need those types of entities. Probably also obvious to say, okay, we're going to need the doctors, we're going to need the hospitals, we're going to need the EHRs, right? But then if you take that down a step further, when we talk about these flow down entities and participants, there's a big conversation around sub-participants. So who are all of the vendors of the hospitals that are helping them to maintain, collect, store this information? Are we talking about cloud service providers? Maybe, right? Are we talking about these application organizations that actually produce the EHR engines? Certainly we are. So when you think about the stakeholders, I mean, I'm of the opinion, Lee, and I talk about this all the time, that could be endless as you move down the chain, and it really helps you think about how many different types of entities and stakeholders are part of the care delivery model and the healthcare ecosystem. And I think it helps you appreciate that there's a lot that are there in order to make this work. But then it begs the question of a few other things. And Lee was starting to go there, which is, if this is going to be a big kumbaya environment where all of this data is coming together and openly being shared, the first thing that comes to my mind as an individual is, wait a minute, how do I know all my stuff is being protected? And what's going to be in place to ensure that all of those stakeholders that are part of that ecosystem are following the appropriate standards to protect that information, right? And then it may also beg the question of, well, what prevents some of those organizations, and Lee had alluded to this before, I think it's important to talk about this. What protects some of those organizations or forces those organizations to share that data? What happens if Sean says, I'm not sharing information, I've got critical information on this patient, and I'm going to block Lee from getting that information, right? So there are other aspects as part of that equation that have been written in, right, from a rule perspective to say, no, you can't do that. Not only are we going to provide the infrastructure and the capability for you to share, but there are instances where you must share if it's going to improve the equation of care delivery. Lee, I don't know if you want to talk about maybe information blocking a little bit.
So this is where some of from a timing perspective, this is where it's important. We've now got, TEFCA, as I said, just got released January 18th. Well, prior to that, last year, we had the information blocking rule, which the Office for the National Coordinator, ONC, released. So ONC now, this whole information blocking rule starts to address the issue that Mike was talking about, which is Sean can't say, well, I'm not going to share my information with B over here or C. I'm only going to share what I want to share. Well, that's not going to fly. So the information blocking rule sets out specific kind of rules of the road on information and data exchange, on what you can and what you cannot block as far as information. So that was very important as far as kind of setting out those rules of the road, as well as CMS itself has come out with their interoperability rule as well. So all of these pieces, Sean, have in fact been released by these various organizations, whether it's ONC, CMS, which are all important foundational components of where interoperability could go. And without them, basically, we didn't have the rules of the road. Now, what TEFCA does, TEFCA specifically now says, okay, we're referring to information blocking. We're referring to the CMS interoperability rule as well as rules of the road. TEFCA now creates as well the rest of the digital highway and the on and off ramps for being able to exchange data. And they put in place the additional rules of the road on how we're going to exchange that data and what you can and cannot do. And we're only going to have a single agreement. So that starts to put in place the how and leverages on the building blocks that we already have in some of these rules and addresses those. That's not to say that we're not going to have other issues. And the other thing that's important is the fact that this is not, TEFCA itself is a voluntary implementation today, meaning organizations that want to participate in here can do so voluntarily. So those organizations that want to be qualified health information networks can do so. We know that there are a number of these health information networks, HINs, that want to move to become and make application to become QHINs. And in fact, if we look at how is this actually organized, you got ONC, the Office of National Quarter, that's kind of put this in place. It's really been the architect. And you got CMS, obviously, that's been supporting this from an interoperability. And this goes all back to 2016, when the 21st Century Cures Act was actually passed, and with a bipartisan Congress. So that kind of set out what needed to be done. TEFCA became a very significant component of operationalizing the 21st Century Cures. And so that actually, the first iteration of TEFCA came out over 3.5 years ago. Since then, it has gone through and what they did as far as ONC, they said, listen, we're going to put in place what is called a recognized coordinating entity. For all of your audience out there, hopefully you're getting at least 20 new acronyms out of this podcast as well. That's a guarantee out of this. But we're trying to explain it. In any event, the RCE, okay, was actually designated as being the Sequoia Project. So the Sequoia Project became the RCE, and the recognized coordinating entity had and has the responsibility to put together and develop, one, the common agreement, which is going to be the single way to connect, and organizations will, from a legal perspective. They've also put together a work group of potential QHINs, or today health information networks, to advise on how this should work. 3, they've been very transparent and open in relation to getting public input as they've developed iterations of this common agreement. So it's taken 3.5 years to develop this common agreement. It's gone through a lot of iterations, a lot of evolution. And we've also seen FHIR APIs 3.5 years ago were in their infancy, okay, as far as development, as application program interface. All the use cases through Da Vinci, as an example, in developing use cases for health plans and with various entities and stakeholders, have come a significant way. ONC, they also formed what was called the FAST Initiative, Fire at Scale Task Force. And that's over 3 years ago. That task force had 7 different Tiger teams that have worked on evolving the FHIR API as well for the industry, and with use cases and technology and security, oversight, etc. So all of these pieces have occurred. We've gotten to the point, and then we had the evolution of these rules last year with CMS interoperability rule and the information blocking. So now we've gotten to the point where TEFCA being released in January, where they're able to leverage a lot of those building blocks. They can leverage a lot of the evolution that's gone on as far as the FHIR, and they came out with a 3-year FHIR roadmap as well, because FHIR is going to be a very important component for interoperability going forward over this next few years, because it looks to become another enablement. So on a variety of fronts, this was really quite an evolution over this past 3.5 years. A lot of stakeholders at the table. The good news is all of them were invited to be at the table, so this was very transparent. But the RCE has really kind of moved this forward with ONC. And I really believe that Mickey Tripathi, the ONC coordinator who was designated a little over a year ago, has really moved this needle on interoperability. I really believe that without the leadership of like a Mickey Tripathi at the ONC level, we'd never be to where we are even today. So now we've got something to really look forward to, but we've got all this implementation, and there's a whole roadmap now. And I think that's what's going to happen from a timing standpoint. They're going to start to finalize some of the common agreement aspects, start to onboard and educate some of these potential QHINs that might want to become QHINs. and start to look to create all that infrastructure and look to start to onboard some of these potential QHINs in the third, fourth quarter of 22. So we'll have some QHINs, I think, by the end of the year, but I really believe 2023 becomes kind of the big year for implementation after all of the infrastructure is put in place. Is kind of my thought on timing, but we'll see some this year. I don't know, Mike. That's kind of my thought on timing.
Yeah, and Mike, I want to get your thoughts on that, the roadmap, because we have the common agreement that says this is what we're all trying to accomplish.
Right.
We have the framework which says this is kind of how we're going to do that. The qualified part, the QHIN, the qualified part says there's some level of trust here, right?
Mm-hmm.
That we're driving hopefully through the common language and the interfaces through FHIR that we're exposing through all these networks. Is there a common way to assess risk and the level of controls and respond to gaps as this is being implemented? Because as we know, if you can build security and risk management in upfront, much better off.
Right. What's interesting about that, so to add, to what Lee was talking about, I agree with the timing. The piece that we haven't talked about yet gets into what you're asking, Sean, the enforcement, right? It's one thing to have all these wonderful agreements in place and interfaces and rules of the road, as Lee was talking about. This has obviously been very well thought out. But I think we all know is if somebody isn't enforcing that or watching over that, then it all kinds of it kind of falls apart, right? And I think when you look at other governmental agencies and the lack of having an enforcement arm for so many years, I mean, look at what happened when HIPAA first came out, right? It wasn't until several years later that the enforcement arm of the OCR was really getting off the ground to say, are people actually following what we've been telling them to do over the last several years? So what's different about TEFCA, to take it back to the RCE, as Lee mentioned, they kind of become traffic cop, right? And at the same time, they're also the enforcement arm to make sure that organizations are following all of the requirements. And a big portion of that is privacy and security. So when you look at the agreement, to bring it back to what Lee was talking about, it's a standard agreement for a reason, which means also the terms within that agreement are standard in terms of what the expectations are relative to privacy and security. Now, there's going to be things in there that you would expect to see. For example, certainly aspects of HIPAA, right? Naturally, we're in the healthcare industry. And then there's going to be other requirements on top of maybe just HIPAA-specific authoritative sources. But I think one of the important things that you'll see is that the RCE is taking that a step further to say, in order to provide that level of trust and comfort to the ecosystem, this can't be just, say, a self-attestation or a security questionnaire, right? They are explicitly indicating that it must be higher levels of assurance that has some form of independent objective validation in the form of, say, a certification, right? Some type of attestation that's been performed outside of just a self-attestation. So I think when organizations try and digest those requirements, they'll quickly see that there are mechanisms and programs that have existed for quite some time that align to those requirements and that will help them achieve those requirements and provide those assurances in the most efficient and effective way possible relative to security and privacy standards. And that's what the RCE is not only preferring, but requiring when you look at the language that they've outlined. And it's not just the QHINs. Again, as we've talked about, and as Lee mentioned, there's a lot of stakeholders part of this equation. So those expectations will flow down to the participants, the sub-participants. And again, what's so interesting about how this has been established and why I think it's very effective is they didn't leave that out when they were thinking about the common agreement either. They've explicitly indicated, look, there's an expectation that those QHINs, if you're going to let a participant enter into the ecosystem, you need to make sure they're meeting the same standards and requirements that you're held to. And those participants should be doing the same thing with their sub-participants, right? So, the security and privacy aspect is critical. And a lot of the things that not just the healthcare industry, but other industries have done traditionally relative to providing what I would even go as far to say is false assurances around having appropriate security and privacy programs in place aren't going to fly when it comes to this equation. I don't know, Lee, if you have anything else to add there.
No, I think that was, I think, a good overview, Mike. I think the other aspect is that what they have done as part of the common agreement, Sean, as well, is that they're requiring organizations to not only use a trusted framework for privacy and security, but it's got to be done annually. And so what they're really raising the bar here. There's got to be some type of annual review as well. It could be an interim review and then a more in-depth review on every 2 years, but they want an annual review. And is also, as Mike said, it's going to go to the flow down to the participants and sub-participants as well. So they really thought this really well. And again, I think they're also looking to leverage what came out of, for example, like the Safe Harbor Bill about a year ago, the Public Law 116-321, that basically identified those organizations that use recognized security practices like HITRUST, like EHNAC, to meet those requirements. That they're really raising the bar here. And I really believe that they also feel that, as Mike was talking about, when you start to look at all these various exchange points that are going to occur, the number of risk vectors that we talk about from a framework perspective increases significantly. So they really, whether it's ONC or the RCE, are really taking this very seriously in relation to assuring not only the privacy and security, by having a recognized third-party entity be the certifier for these entities, whether it's a QHIN or the participants or sub-participants. But also, we've developed this trusted network accreditation program in conjunction, in partnership with HITRUST, in which we have aligned all of the requirements of the common agreement with TNAP. And so it's privacy security, it's all of the provisions that are in this common agreement that we have aligned into this accreditation certification program. Makes it very robust and very comprehensive. What we're not saying to organizations is that, hey, you go through our program, you're guaranteed that you're going to be approved by the RCE. It's really the RCE is the only entity that has the responsibility and the accountability under ONC for approving QHINs. But what we're trying to do is to raise the bar on that whole trust aspect and stakeholder trusts out there, whether it's a patient, whether or not it's a payer, whether or not it's a provider, the QHINs, all these various stakeholders. We're really trying to raise that bar on assuring that the level of stakeholder trust is there for all of this patient exchange, and to assure that the common agreement and the provisions for the common agreement are being followed.
Yeah, maybe Mike, I don't know if you want to elaborate more on the Trusted Network Accreditation Program, TNAP, because what I hear is we want to have some of this in place by the end of this calendar year, certainly into 2023. We want to see widespread use of this. We can't introduce more chaos by pushing this stuff through, right? So just because we have an agreement and a framework in place doesn't mean we can abandon all the all the other stuff that we've built so many years, or take so many years to build through HITRUST and the work that Lee does with EHNAC. So how does the TNAP program come into play? I'm envisioning a quick introduction for HINs that say, here are the steps you need to take to fortify your network and your process and your procurement and all that stuff in line with TEFCA, or how does it work?
Yeah, so a few things. First, I think it's important to highlight what Lee mentioned. You know, like many different government standards and regulations, that they're not going to explicitly point to one silver bullet, right? To say, oh, there's reciprocity and this is going to meet all of our requirements, and as they shouldn't, right? There should be multiple mechanisms for organizations to provide that level of assurance. But I think, Sean, a couple things. I like the way that you asked it, which is there's been many types of mechanisms in place for many years. So what makes this different? What I would tell you is, and I think Lee nailed it, is with TNAP, we have explicitly built it to align to the various requirements that stakeholders will have under TEFCA, right? So as opposed to trying to piece together these 4 or 5 different certifications, accreditations, and maybe with a little bubble gum and popsicle sticks, we could say, look, we think we've satisfied all the requirements. We're trying to make it more efficient and more effective for organizations to say, here is a perspective, right? And we have outlined that for you. We understand the requirements that you need to meet. A, because we've collectively been helping organizations with this for years, right? B, a lot of it isn't significantly different than what you should have already been doing for years. Whether you're actually doing it or not is a different story. And C, if we think about this spirit of what interoperability is all about, we talked about this, right? More efficiency, more effectiveness. We want to make sure that a mechanism that we're offering to the marketplace is in line with that spirit, right? To achieve the requirements of the common agreement. So that's why we built TNAP the way that we did. It does certainly provide a roadmap for organizations. And if for nothing else, it helps them get ready as well and evaluate if they do want to make that splash into becoming a QHIN. So I do want to comment upon timing, because you mentioned, hey, this is going to be relevant later this year, certainly 2023. I would argue the time is now, right? And we've designed this program to help organizations be ready if they so choose, as Lee mentioned, to apply to be a QHIN. But more importantly, if they're going to be participants as part of this ecosystem, right? It's not something that you can wait for in 6 months down the line. You want to apply to be a QHIN or be part of the ecosystem just to find out, wow, our entire security and privacy program is not up to par. Right? So now how many more months is it going to take in order to do that? So Lee and I are in the market right now, and we have been for several months, trying to help organizations get in front of that, so they're not faced with that when the time does come to become part of the ecosystem.
I think the only other thing I would add to what Mike was saying is, Sean, is that there's 2 components that what we've built. One is obviously the privacy and security aspect, and we're leveraging the HITRUST framework. And then the TNAP, the other component, we've taken into account all the common agreement, the legal aspects of the common agreement. And I was talking about as well, there's a QHIN technical framework that's also been proposed and outlined as part of the common agreement. So all the provisions on technically what organizations need to do to become a QHIN, to make application, the legal, the standards. And so the other aspect is they're leveraging existing standards as much as possible rather than creating a whole new set of standards. No one needs another set of standards. So they're leveraging the existing set of standards that are already out there, that are proven, which again helps, I think, with adoption. So we've taken all of that, all of those components, those provisions on the QTF, the common agreement, the privacy and security, and packaged it under a single package called TNAP that we're offering to these entities that want to become QHINs, the participants and sub-participants. And the other aspect of the QTF is that the RCE has put in some of their own technical requirements on how they want to test various connections. All of that we've also built into not only the technical requirements, but the business requirements. So it's, we've given it a lot of thought. And again, one of the things I can tell you is we started developing this program over 3 years ago. And we put together a steering committee of about 30 healthcare organizations over 3 years ago to start this. So we have continued to evolve this as TEFCA has evolved as well. So we're not just newbies. We didn't just say, gee, yesterday, hey, let's develop this program. So, it's been a lot of work and a lot of effort on the part of a lot of people, but that's how this all aligns.
Yeah, and I appreciate that additional insight there, Lee. And what I'm thinking here is, as we come to the close of this conversation, I mean, there's so much more we can dig into, but I want to circle back to the beginning, and I want to use the word Mike used, which is spirit. And I know both of you hold this spirit of enabling every part of the health ecosystem to provide better care. And what I know each of you do with your respective organizations is to help reduce the friction, make that onboarding to new things like TEFCA as a great example, easier, right? If it's too difficult to be part of it, it's too expensive to be part of it. If you don't even know how to start to be part of it, you're not going to take the time and invest to be part of it. So what I love about this conversation is your goal, as you've been doing for years in this space, is to reduce the level of effort, to reduce the level of cost, to reduce the level of frustration, to make it possible for everybody up and down the healthcare stack to do their part to provide better care. And I think we've reached a point where interoperability is necessary. I use the word critical at the beginning of the conversation. I think we're at that point. And to Michael's point earlier as well, the time is now, right? To understand how we, including us patients, can be part of this system to hopefully get better care for everybody. And so TEFCA's here, TNAP's available, HITRUST and EHNAC working together along with other stakeholders that help define this agreement and framework. And Michael, Lee, I appreciate you sharing your insights here and for doing the work that you do to help make this possible. Michael, quick moment, final thoughts from you as we wrap.
Yeah, we're all part of the equation, Sean, to your point. I think the listeners will hear how passionate Lee and I are about this. And it's about enablement. And if we can enable those stakeholders that we know are critical to making interoperability work, that's what we want to do. And we see ourselves as part of that equation through enablement. This does not need to be overly complicated. And if it is overly complicated, then that impacts better, quicker care delivery. So that's how we see ourselves fitting into the equation. And we're very passionate about it.
Yeah, I can hear that. And Lee, final thought from you as well.
It's all about stakeholder trust. It's all about raising the bar and creating the highest level of stakeholder trust across all of the various stakeholders here, including patients, which is really a very key component, is really raising the bar to allow patients to have a lot more access to their data or caregivers. And we are passionate about it. As Mike said, we are very passionate. We've been in this. And quite frankly, it's a significant opportunity for all of us in this ecosystem to really make a very significant change for the future. And I think that's our opportunity to work together as well. It's all about collaboration, and it's going to take all of us working together to make it a success. Sean.
Yeah, I love it. And I think we successfully, not purposely, avoided the word transparency, but collaboration with transparency, I think is key. So I could keep talking. I'm going to stop. If Mark, my co-founder, was here, Marco would be kicking me on the side to say that's enough. But I think seriously, super important conversation. Thank you both for sharing your story with us. And we all have a role to play, one side or the other, or both in many cases as well. So thanks, Michael. Thanks, Lee. And thanks everybody for listening to this story.
If you enjoyed this podcast, share ITSP Magazine with your friends, family, and colleagues. Thank you for listening.